We know that undiagnosed Lyme causes fatigue, autoimmune conditions, and neuropsychiatric issues in elderly and even schizophrenia in younger patients. We also know that with proper diagnosis, many of these symptoms can be treated and the disease reversed. My concern is that many Michiganders who are suffering from unexplained symptoms may think they've been tested for Lyme, when in reality, they have not, because the standard test is not thorough enough. What can we do together to make sure that people are getting thorough and accurate testing for Lyme disease to stop these types of spreads, sir?
I now recognize Representative James for his 5 minutes of questioning.
Mr. Secretary, I want to thank you for your courage. As somebody who's a Democrat his entire life, and this time, 2-3 years ago, ran as a Democrat, now sitting here choosing the people over a party, I want to thank you for your courage and your leadership. Mr. Secretary, the Department of Health and Human Services issued a rule in 2020 requiring healthcare providers to clearly label prices so that patients can make informed decisions about where to get treated. Under the Biden administration, that rule was not enforced, sir. As a result, patients end up paying radically different prices for the exact same services and the exact same level of care. We're talking hundreds of thousands of dollars different. That's wrong. Dilbert cartoonist Scott Adams had a term for this kind of system, confusopoly. He called it that because the friction makes it difficult to shop around by design. In 2025, President Trump issued an executive order to make America healthy again, which included an April 1st deadline for healthcare providers to comply with price transparency laws. Sir, that deadline was 3 weeks ago, and yet a third of hospitals in Michigan, and I have to imagine around the country, have not fully complied. A big part of the problem is that HHS does not have strong enough enforcement mechanisms. That's why I introduced Patients Deserve Price Tag Act to require price transparency by law, with consequences for health providers who continue to hide their prices from consumers. Mr. Secretary, will you support my efforts to lower prices and increase access, transparency, and quality of care for Americans who are struggling in today's sick care system in America?
Yes, I thank you for that legislation. We have already finalized regulations that are now requiring all hospitals in the country to post and certify their prices. And so patients will be able to, if you go into a restaurant, you are able to see the price on the menu. If a car dealer told you, you can buy this car, but I'm not going to tell you the price till afterward, you would not buy it. But that is what the hospitals are asking you to do.
Thank you for increasing transparency.
And we are changing that.
Choice. Thank you, Mr. Secretary. I would appreciate your support on making that permanent so that it cannot be ripped away from the American people after this administration is concluded.
Happy to work with you.
Thank you, sir. Mr. Secretary, ticks are becoming a bigger problem in Michigan and around the country. My wife and son have Lyme disease and other co-infections, but they don't show through standard antibody testing. If you have the ability to pay for a high-cost test like IGeneX, it shows the strains and confirms Bartonella in her red blood cells, and my son has Babesia in his red blood cells. We know that undiagnosed Lyme causes fatigue, autoimmune conditions, and neuropsychiatric issues in elderly and even schizophrenia in younger patients. We also know that with proper diagnosis, many of these symptoms can be treated and the disease reversed. My concern is that many Michiganders who are suffering from unexplained symptoms may think they've been tested for Lyme, when in reality, they have not, because the standard test is not thorough enough. What can we do together to make sure that people are getting thorough and accurate testing for Lyme disease to stop these types of spreads, sir?
Yeah, I mean, this is a priority for us, Congressman. Lyme disease has been a hidden disease because the government has been denying its existence. Prior to me getting in, heads of my agency, the leading heads of NIH, were telling the American people it's a myth, it doesn't really exist. And we've changed all that. We've conducted a Lyme roundtable with the best experts from around the country. Many people from this body participated in it. We put up a web page. I'm not sure if it's up yet, but it should be up so that people can find the best physicians for treating it. We're putting large amounts of money into Lyme research, and absolutely we should be doing pre-screening for people to see if they have it. So many millions and millions of Americans have this disease and don't know it. And it's absolutely debilitating to their lives.
Mr. Secretary, in the time that I have remaining, are there any questions, comments, or concerns that you feel like you have not had the opportunity to address?
I mean, I would say the same thing about long COVID, and we're addressing that too. We're getting the best physicians in the country together. We're identifying the treatments and the protocols that work and those that don't, and we're giving patients for the first time good information about it.
Thank you, Mr. Secretary, for your leadership and your patriotism. God bless. With that, Madam Chair, I yield.
Thank you.